On behalf of the National Network of Public Health Institutes, thanks for joining us today, and to all of our listeners, welcome back. I am Vincent LaFranza, and I have the honor and privilege of serving as NMPHI's president and CEO, representing and partnering with 45 public health institutes with over 8,000 subject matter experts, our nation's regional public health training centers. NMPHI's mission focuses expressly on promoting multi-sector activities resulting in measurable improvements of public health structures, systems, and outcomes. So in a nutshell, we build muscles to strengthen our public health system using public-private partnership approaches to protect and improve the public's health. And today I am especially fortunate to be with Dr. Gloria Ayensu, who is the Director of Health with the Fairfax County Health Department here in Virginia. Before we dig in, I do want to acknowledge the catastrophic public health impacts of the completely unwarranted war in Ukraine. Our hearts go out to all of those needlessly suffering from this horrific event. I know our network stands ready to support any individuals who land on our shores, as we know many Ukrainians will be displaced for decades to come. Prevention is the heartbeat of public health, and as a global community, we must work harder to prevent war. But I really am very privileged today, and I want to stay focused on why we're here. So it is a privilege, Gloria, to have time with you, and congratulations to you on your important work and impressive accomplishments. I was a resident of the Fairfax County for over 20 years, so I know firsthand as a resident just how much the health department transformed under your terrific leadership. Again, special thanks to our listeners and welcome. So let's dive in. Gloria, please tell our listeners more about yourself, your background, and your work with the health department. And it's such a terrific mission.
Yes. So thank you for having me on this program. I'm originally from Ghana. I graduated from Tulane Medical School, did my residency in preventive medicine at the Loma Linda Medical Center, and then joined the preventive medicine faculty group for 2 years before joining the Fairfax County Health Department in 1999 as a public health physician. Then came 9/11 and the anthrax crisis that followed. And while these incidents of terrorism were defining moments for public health in general, it was more so for our health department and me. The Fairfax Health Department was one of 2 local health departments in the National Capital Region that had to open a pod for potentially exposed postal workers who needed antibiotics. And that experience taught us some important lessons about emergency preparedness and response that continues to shape and inform our work. And that is, it takes a village. Personally, those events ushered me into public health administration. I was asked to lead the department's response efforts since we didn't have a health director at that time. And what I had assumed would be a temporary assignment turned out to be an appointment as health director. So fast forward 20 years later, it's been an incredible journey of serving a very diverse community of about 1.2 million people who represent over 180 languages. Over 40% of the population in the county speaks a language other than English at home. And while the county is considered affluent and enjoys an overall health rating that is good, significant disparities exist. Over 80,000 of our residents live in poverty, another 100,000 are uninsured, and there is a 14-year gap in life expectancy across zip codes. Because we have complex challenges across a diverse population, that doesn't really lend itself to a one-size-fits-all approach. And so over the years, we have invested and continue to invest in strategic community outreach and engagement efforts, which have enabled us to build sustainable partnerships within our diverse communities, which we leverage to extend the reach and impact of public health efforts and address the social determinants of health.
Yeah, fascinating, and it's amazing how we have these life expectancy, very very artificial gaps that
Mhm.
can be addressed. And I do hope you're very proud of the work you're doing to respond to the COVID-19 pandemic. Gloria, can you share some highlights of how you're partnering with the community to build local capacity?
Yeah, certainly. As you know, public health is a team sport, and we're very grateful for the incredible community partnerships that we have developed over the years and what we've been able to accomplish together, especially during the past 2 years in response to the pandemic. You know, MRCs are the backbone of public health surge capacity. Here in Fairfax, we are fortunate to have a very active and well-trained MRC volunteer force, which has provided over 70,000 hours of service in support in support of the pandemic response. We've also partnered with our healthcare institutions, several pharmacies, and one of our colleges to vaccinate hundreds of thousands of people who were on our vaccine registration wait list. This partnership really enabled us to accelerate, our vaccination effort and also to exceed the president's COVID vaccination goal of getting at least one dose of vaccine to 70% of adults by July 4th, 2020. Additionally, we've been able to leverage contributions of over 300 community partners in the planning, outreach, and execution of community testing and vaccine equity clinics in areas of the county with high transmission rates and low vaccine uptake. And as a result of these efforts, about in excess of 77% of residents are fully vaccinated. 86% of adults have received at least one dose. 94% of children 12 to 17 have at least one dose. And 58% of children 5 to 11 years also have received at least one dose. And I think that is really impressive. Our work is not over, and so we continue to engage with our community partners. One, partner that I'd like to, mention, our Multicultural Advisory Council. This group comprises of leaders within our ethnic minority communities, and they have also been instrumental in amplifying public health messages to our diverse communities, and they serve as trusted sources of information for our community, and they've been doing a fabulous job as well.
Wow, fantastic! Those numbers are just amazing. Which for me doesn't surprise me how much great work that you're doing with your whole team there. In our previous conversations over the years, I have come to appreciate your deep understanding of working with nonprofit partners to build this capacity, including the Institute for Public Health Innovation, which is one of NPHI member institutes, as you know, along with many other partners that you work with in the region. In full disclosure, I do have a special allegiance to IPHI, as I was a creator of the Institute many years ago now, and we certainly did not predict we'd be living through a pandemic quite like what's unfolded. But that said, what are you learning about how public-private partnerships can build lasting capacity?
I think our partnership with IPHI has been the best strategic move of this entire pandemic response. As you know, health departments across the nation do not have the workforce capacity required to sustain large outbreaks, and certainly not a pandemic. And neither do we have the HR infrastructure to hire and onboard large numbers of employees within a short time frame. So when we adopted, our box-it-in containment strategy um, to contain the the virus within our community, we looked at the numbers, and it necessitated that we hire in excess of 500 additional staff. And so what we did was enter into a partnership with IPHI to help build us a COVID response workforce that included case interviewers, contact tracers, community health workers, epidemiologists, and supervisors. And so IPHI in turn recruited, hired, and trained cohorts of these contract employees who were then transitioned to the health department's response infrastructure after additional training at the health department. This was a really seamless operation. Was something that could have gone awfully wrong, but the partnership has been so solid, and it's been able to get us, staff, contract staff on board in a very timely manner. So one of the biggest pluses about this arrangement is that since IPHI assumes all the HR related functions for these employees, it has allowed our health department to focus on the response. And during the course of the pandemic, these contract employees who have predominantly been placed on the containment team, they've been able to be cross-trained and reassigned to fill other response positions when cases decline. And this strategy has allowed us to retain a highly skilled contact tracing machinery that is able to scale up to meet surge demands, as well as enlarge our footprint in targeted community activities aimed at closing the equity gap during periods of low demand. We've also been able to hire some of the high performance into merit positions that have become available at the health department. As I said, overall, it's been a great partnership, and I hope that local health department will take a look at this model and explore it to meet unique workforce capacity needs post-pandemic. We certainly plan to do that.
Yeah, I think that's wonderful. We are seeing more and more of this around the country. So this podcast will even help influence a lot of the new health officers as well, give them some new ideas. We also know the pandemic is teaching everyone and every system very important lessons that should help guide the future of our public health practice. Can you share a few of the most important lessons that you have learned?
So lessons learned. Well, the first thing that comes to mind is individual and family preparedness amongst staff as well as the entire community. This is critical for building community resiliency. The second lesson has to do with the importance of engaging with community and establishing trust before a crisis. As we've seen throughout the pandemic, community partners can play roles that even the most seasoned health department employee cannot do, and that is serve as trusted voices for conveying key messages and addressing misinformation. Another lesson that I'd like to touch on is communications, and specifically the art of communication that goes beyond, providing facts, but instead provides information in a way that connects the dots for the public so that they not only understand the what, but the why behind the messages that we are trying to convey to them. I believe that if done successfully, it can improve adherence to public health guidance. It will be able to decrease the confusion and frustration that sometimes has occurred with changes in guidance throughout this pandemic. And I think that it will ultimately go a long way in building trust in public health.
Yeah, these are really very important lessons. And the trust issue is we're seeing it all over the country with new laws coming, on the books that are sort of weakening public health. So we do, and that does speak to trust. So we have a lot of work to do on that. Gloria, what do you think the greatest weaknesses are in our current public health system?
So obviously, not being adequately resourced is public health's Achilles heel. And that challenge is only exacerbated when we find ourselves in situations that require us to respond to long-term emergencies, which is typical of public health emergencies. So it is my hope that initiatives like staffing up helps local and state public health agencies make the case for sustained funding to shore up the public health infrastructure, which also includes, developing our workforce and enhancing our capacity to um, 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 to address the functional capabilities and our preparedness and so on and so forth.
Those are important things to do. So what about our strengths? What are our greatest strengths in the system?
I think our workforce is our greatest strength. I mean, public health workforce. I've never seen a more dedicated group of men and women who are passionate um, about the mission and want to make a difference throughout this pandemic. And I've said this everywhere I've been, that I'm so proud of the bravery of our workforce, and how in the face of uncertainty they they've stepped up and worked tirelessly. And I'm also very thankful to our community partners, especially our Medical Reserve Corps and our Multicultural Advisory Council. I mean, they are proof that it pays to invest in sustainable community partnerships.
Yeah, amazing people doing amazing work.
Mm-hmm.
So you have touched on some of this next question already. So just building on it, when you think about the future of public health practice, what specific recommendations would you share as the county works to modernize and build a stronger public health system?
Great question. I mean, I think public health needs to be innovative. We need to be responsive and adaptive in meeting present and future public health needs of the community. I'm not sure we'll ever get the full resources we need to get, the job done. And so we need to find innovative ways to increase the functional capacity of our existing staff. And then we have to be also willing to do things differently. Um, I think we also need to be intentional about engaging with our community in order to identify areas of strengths and opportunities for capacity building that can be leveraged to better address gaps in our services and advance health equity efforts. Um, it's important that in our work with community that we do with as opposed to do for community. Because a lot of the solutions that we seek to improve community health already exists within our diverse communities. We just need to figure out how best to tap into those assets and better align them for collective impact. And you know that's that's what I think our chief strategist role is about. Um, and all levels of staff within our health department need to be equipped to operate in that role within the environments that they are assigned to work. And then lastly, I think, we talk a lot about equity in public health. And when we do, it is often in reference to, our partners in other sectors, and the work that we need to do with them. But I think it's important that we also apply an equity lens to all aspects of our work, our policies, our programs, and practices, in order to transform our organizational culture and improve community health outcomes.
Yeah, wonderfully important work to do. I know many of our organizations are doing more with health and racial equity strategy, and we've got a good decade ahead of us to turn around a big ship in public health to really make more of a dent. We also know there's a lot of new people coming into public health, and some of them are new health directors. What advice would you have for new health directors in this challenging position that you do so well?
So, I imagine that all of us have great teams that we lean on, and we should continue to lean on our teams. But I'd like to also recommend that if your health department does not have a community advisory group that you can readily lean on, that you begin to engage with the diverse communities within your jurisdiction with the initial goal of just showing up to connect, and hopefully over time identify committed, passionate leaders who you can partner with to help you and your department better understand and connect with their communities of influence. In saying that, I know that we're so busy, and there are many things that compete for our attention, but we need to carve out time to engage with community so that they can help us help them.
Wonderful. Well, I know that I've learned so much from you. Thank you for sharing with us today. It is definitely my honor and privilege to work and learn from you over the years, and I wish you much continued success leading the Fairfax County Department of Health. You're doing such a great job, and I hope all the residents learn about your work through some of this work that we do with these podcasts. So to all of our listeners out there, thank you, and over and out for now until the next time.
Thank you.